Hi, my name is Emily Ansager, and I'm a University of Missouri student and a SHAPE peer educator. I'm at the Student Health Center today, and I'm going to talk to current healthcare professionals about LGBTQ health. They're from a variety of fields, including nursing, mental health, and general medicine. They're going to be sharing their experiences working with LGBTQ patients, and then they're going to give some tips for future healthcare professionals when working with LGBTQ patients.
Working on issues that feel important to me and trying to make healthcare more, safer and more, embracing for the LGBT community, because there's a need, and often LGBT folk don't feel safe coming in for healthcare, and that's not what we want. We want people to feel safe. We want people to, be able to address whatever issues they're experiencing and, get the help they need.
Here directly from an inpatient background. I was a house manager. Gender patient would come into the hospital, and it always became a really major issue of where to put that patient. And so I have to be perfectly honest, when I came here, I had a very negative view of transgender people, because the ones that I dealt with as a house manager had already been, quite frankly, probably embarrassed and treated very rudely by many staff along the line before I walked in. And so by the time I got there, they were very angry and very demanding. And so I think that's what my view of what a transgender patient looked like. It hung my head in shame that I had not really directly been rude to any transgender patients, but I certainly had not been as welcoming and as friendly and as helpful as I could have been. And so I think for me personally, it became a goal that if I could understand the transgender world, then pretty much anybody would be able to do that as well. I think a lot of us, including myself, come from small town, and it's just something that people have not encountered.
Challenges I've overcome in taking care of LGBTQ patients really relate to what am I qualified to do? I see that primary care docs are like perfect setting for LGBT and transgender individuals. And so having someone who can address the full scope is really allows a better healthcare. Some of the tips I would offer would be really, educate themselves by looking at resources that are available.
I think that probably first and foremost, you need to educate yourself on LGBTQ issues.
If there's any courses offered, take them. If there's any, there's lots and lots of videos that are, DVDs that are educational on these issues. There's some excellent ones on people's experiences. Go to movies about, go to gay movies, because that'll help tell you more, give you more. And you can always read really good memoirs or also books on healthcare that are about this issue. There's plenty of ways to do it. But the biggest thing is being open and really looking at your own assumptions and understanding that you have a different experience.
They want us to ask how to interact with them, and that it's okay for us to say, hey, I'm really trying here, but you're maybe the first transgender student that I've met, or I've had very limited experience in working with transgender students. So I'm trying really hard, but if I say something offensive, it's not on purpose. I'm trying, and I want you to correct me so that I can learn from that and do better next time.
Really look at your own assumptions and your own background and really understand where you're coming from. And if you're not LGBTQ, so how much privilege does that give you? How much safer is the world in a sense? Where you can go and where you can't go and is different. So really understanding that you don't have to think about, if you're a man and a woman, you don't have to think about holding hands in public. You can just do it. If you're gay, you have to think about that, about where it's safe, where it's not safe, and what that might mean. So just really understanding that experience as best you can.
Participating in events that they have access to on campus or in the community.
The more contact you have with LGBTQ individuals, the more you're going to know, the more you're going to understand. And so that might mean becoming involved in, community issues. I mean, like
using language that would be, for example, not identify, for example, a partner as male and female, but using language that would just identify using the term partner.
Really, one of the key things that I would want to drive home is there's this tendency, everybody just says, well, I'll just treat everybody the same, I'll treat everybody equally, and that's good enough because I'm treating everybody with respect. And the problem with that is everybody has different experiences, and when you're talking to any community that experiences large-scale discrimination, if you just treat them the way you would treat everyone else, you're often perpetuating that discrimination, and that's important to know. You can't just treat everybody the same because you're working from a framework of your own experience, and so it's important to understand what other people's experiences are. And any minority group that's out there, as a professional, we need to try and understand what the experience is like, on a day-to-day basis. And so educate yourself as best you can and be open to it and recognize there's no, just because you don't have that experience doesn't make you bad. Just because, you might have assumptions that you're bringing forth to the table that you have to grapple with doesn't mean you're a bad person. It just means, okay, this is my experience. This is the context I came out of. Now let me learn about other people's contexts, and they might be different than mine.
Changes in the way we have the signs in the bathroom to catch a clean catch urine, for example. We've made a change in the bathroom that we have a gender-neutral bathroom.
Educating the staff that you're working with has also been an important thing in terms of using preferred names, using preferred pronouns, and just helping the staff feel comfortable because, again, they really want the best. They want to provide the best care, but they often need education and some training to be able to do that.
So, competency really involves awareness and knowledge about LGBTQ experiences, and being able to create a safe space where, patients, clients can come in and ask for what they need, whatever it is, and feel like that's safe. And also, and you're not focusing on their identity unless it's part of what is essential for the presenting concern, whatever the concern is. So, if someone comes in, I might have someone come in who's gay, and we're never actually talking about that because it's not really an issue that they're struggling with. They're at peace with that, and that part of their life is working well, and so that's not what I'm talking to them about. So I don't want to make a big deal of that because it's not, right? And from the perspective of mental health or from the perspective of a doctor as well, it matters when we're talking about sexual health, who you're sleeping with. It matters, how you're doing it. That matters, right? But if we're talking about other issues, it doesn't matter. So just being cognizant of what matters. And so competency involves a lot of different issues. And I think the biggest piece of it is being respectful of the person you're working with, admitting what you don't know, asking, but also having some knowledge about LGBTQ experiences, and that you get by, experience, by contact, and if you don't have a lot of contact, you can read people's life stories and read about their experiences, read also about discrimination and barriers to healthcare, and I think that's really important to know.